welcome. You're watching Medically Speaking on NewsX, newsx.com, and on our website, Medically Speaking. This is our Independence Day, a day when we celebrate freedom, a day where we cherish the hard-fought freedom our freedom fighters fought for. But are we truly free? When we speak of the medical sector, are the professionals, our saviors, as we call them, are they safe? Do they feel that they are free from violence? I wish the answer was yes. Unfortunately, their ordeal in the past 1 year or so especially has shown us a very grim and a different picture. To discuss more on that, I have the AIMS panel today with me. All the doctors are from AIMS. This is, of course, everyone knows, the elite institute in the national capital. Dr. Kaushal Verma, he's a professor of dermatology there. I have Dr. Sarat Chandra, professor of the neuro department. Dr. Rakesh Garg, he's an assistant professor in the anesthesia department. I'm going to start with Dr. Verma first. Dr. Verma, would you say, as someone who belongs to an elite institute, something we look up to, would you say that professionals from your field are free from violence? If not so, how grim is the situation? And what has been your experience handling COVID patients, dealing with the rage of some understandably disturbed but exceptionally enraged relatives of patients, and how difficult has been it for you and others from your field, sir? Over to you.
Thank you. Thank you for inviting me to your show. Let me first wish a very happy Independence Day to everyone.
Yes.
It's a great distance that our nation has traveled in the last 75 years. And you have put too many questions in one, which I will try to recall and respond one by one.
All right.
The first thing is that is the medical profession free from, does it have the freedom? Let me first tell you this, that for us, the freedom is, or for every one of us, the freedom, medically speaking, is the freedom from illness, the freedom from disability, the freedom from ill health. And of course, everybody has the right and entitlement to have a good, healthy, fit life, apart from the mental freedom. And of course, the physical freedom we are particularly aware of. So after having said the mental freedom, that is a very wide thing, the freedom for the medically people who are in the medical profession, are they free? And then in that context, you also asked the working situation, the conditions where the medical professionals work, are they actually free? In this context, I think it is also referring to the attitude of the society, the patients, their relatives, and also sometimes the violence which happens in the hospital premises or in the clinics or in the healthcare settings. I think there are several reasons. There is not one that we can pinpoint. And one, the very important one, is the dissatisfaction, the gap between the expectations of the people, the family, the relatives, the patient, and the medical profession, what they can provide. And this gap has got, different, there are different...
manifestations, yes.
Yeah, there are different factors for this gap. One is the availability of the healthcare facilities. That is very important. So there is a huge gap between the demand and what we can provide. So the people expect something which the doctors or the medical professionals cannot provide because of the lack of availability of resources. At one stage, I remember there was an incident, I think probably in Maharashtra or maybe in Madhya Pradesh, where the violence occurred in the hospital premises because a patient, the accident victim, was brought to the hospital. He had head injury. The CT scan was not there. And hospital did tell that to the relative of that patient that please take him out away from this hospital because we don't have the CT scan. And probably the person died because of, say, non-availability of CT scan in that hospital. And then there was a violence. It wasn't, say, absolutely hospital's fault or the doctor's fault or the healthcare professional's fault, but the facility was not available. But the relatives were unwilling to take him away from that hospital, considering that the patient was sick, but they wanted everything to be done then and there for that patient, which is, say, very unfortunate. The same thing is happening in across the country, I guess. The primary healthcare system needs much more strengthening. So the people who are basically requiring primary healthcare, they should not be coming to the secondary centers. And the people who are deserving care at the secondary centers, the facilities should be such that they don't need to come to the tertiary centers or to the bigger hospitals. And the bigger hospitals should be providing care for the people who are critically ill or who are basically requiring care at the tertiary level.
Yes, sir.
But
No, I totally agree with you here, sir. I'm a patient. I'm not a medical professional. I sympathize and empathize with the sentiment. But, Dr. Chandra, perhaps you could come in here. Point well taken, Dr. Verma. And I understand, yes, empathy, sympathy, of course, with patients like me. Dr. Chandra, yes, there is a big difference between expectations. Primary healthcare of this country is in shambles. We all know that. When it comes to tertiary also, it's not like a doctor doesn't want to save lives. A doctor tries his level best. That's something we all know. We all come when Prime Minister Modi says, we all clap for you, we all shower flower petals on you. But is that gesture enough? Understanding the anger of people is okay. Respecting doctors, people do. But what happens? Why this violence? Is providing extra security the only solution, sir?
So it's a very good question that you asked, and I would like to spend a couple of minutes answering this, because I would like to approach it more from an holistic point of view. Because what we are seeing is just a warning signal, and doctors are getting implicated because they are the soft targets. They're the expression of frustration for the patients because they have nowhere to express their frustrations upon. So if you look at this issue, we could deal it at a local level or at a national level. And at every level, we could deal it with either the patient or the doctor or the hospital. So let us first consider the patient at a local level. Obviously, like Professor Verma was mentioning, there is a lack of trust. Many times the patient have to indulge in out-of-pocket expenditure because they do not have enough insurance coverage. And many times the hospitals kind of fleece off the patients more than the coverage that they could afford for. So they have a coverage for 5 lakhs. The hospital could bill you for 7 lakhs or 8 lakhs, what was happening during the COVID pandemic. So obviously that is the issue which could raise at the patient level. Now at the doctor's level, I think it's very important for us. Yes, we do understand that we are working under a great deal of pressure, but I think it's high time for us to introduce a specific subject on ethics and patient counseling, which is so important in countries like UK.
Since we are talking of suggestions, Dr. Garg, please come in here, at this point of time. We have, I think, some very interesting suggestions when it comes to, of course, improving the primary healthcare, when it comes to online SOPs for doctors. I think a curriculum in doctor ethic behavior, important. As far as the people are concerned, sir, what would be your suggestions? How do we change this attitude, this sort of, looking at the doctor with suspicion? As I said, empathy and sympathy with the patients. They were losing their loved ones, of course, very difficult time. But how do we get people to understand that violence against anyone, doctors especially, is totally unacceptable?
Actually,
Dr. Garg, over to you.
Absolutely a very important question, because finally we all are working for our nation in whatever profession we have. The person are spreading the positive vibes. The medical professional from all aspects are creating a lot of information, medical infrastructure and services across various platforms. Now, if we just take it very broadly, why this violence is happening? There is some mismatch between the expectation. This is one, and secondly, which Professor Verma and Professor Chandra also mentioned, the gap somewhere in the communication gap is very wide, and because of many reasons, this is getting more widened up. Now, let me give you a very pertinent example, and you must have seen it. I'm not criticizing anybody. I'm just giving you a reality, and I have faced it, and you must have seen it also. Let's say if a roadside traffic accident happens, and it's mid of the road, what all we do?
Which is possible, you're right. The apathy, the sheer apathy, we all know about it, absolutely.
Absolutely. So now, point here is, if something is in the middle of the road and is bleeding, right, we need to have medical services. We do agree that within a minute, within 3 minutes, we need to provide them a medical services with advanced ambulance. It will take some time, 3 minutes, 5 minutes at least, for the ambulance to reach there, and we all are working to provide those services. But in those 3 minutes or 5 minutes, who is the right person to help that patient? It's a responsibility of every citizen of this country to help that person. Should we go ahead and say, don't make a crowd, don't make a video here. Just if patient is bleeding, just take your dupatta, hanky, your shirt and keep on the wound and press it. How many times this happens?
Yeah.
Secondly, if you see, you must have heard patient gets in cardiac arrest at home. 80% will get cardiac arrest at home and the patient will be brought to the hospital. I fully agree. We need to empathize with the patient. I will not say sympathy here. I will say empathy for the patient here because they are losing someone. But then bringing the patient from home to an hospital, nearby facility will take at least 10 minutes, 15 minutes or 20 minutes. And we'll say the golden minutes. We talk of golden minutes. The patient survival chance decreases if no intervention is done in a minute. The chances of decreasing of a cardiac patient revival is 10%. It decreases by 10% every minute. Who is the right person to be here? I again say it's a lay person. It's a common man. Now its point here is, are we creating appropriate awareness from both the ends? Are we accepting that as a lay person, I'm going to provide CPR to the patient? I'm providing the immediate first aid to a bleeding patient. I'm providing
point taken, sir. You know, as I go back to Dr. Verma on the first point he made to sort of, widen this debate. Not just apathy, there was, of course, just recently it was CRPT, and I mean, we just spoke to doctors and others. People didn't even know how to, give a basic resuscitation. So that, of course, is totally acceptable with Dr. Verma. And I want to come back to you on the first suggestion. Sir, in the beginning, you'd given the suggestion that we need to improve our primary healthcare. The focus of the government clearly is on tertiary healthcare. Look at Ayushman Bharat, for example. We are giving insurance also for tertiary healthcare, improving primary healthcare. Good suggestion. With all due respect, sir, it's going to take some time. It's today that the doctors are getting beaten up. What do we do today?
Well, I think, as I said in the beginning, the between the need and what we can provide, there is a huge gap. So we'll have to put in more resources. We have to build up the infrastructure. It's not one day job. It should have started many years back. If we start doing it now, it is going to take several years to reach to that level.
But look at the amount of money we spend on our health every budget. It's really a fraction of what should be spent.
Absolutely. There has to be a significant and a sizable increase in the health expenditure to build up, because the health is considered to be not a very important sector for government to invest, because this is the sector which actually consumes. It does not produce anything in terms of the financial gains for the society or for the nation. But it is building the people, and the people are the one who are, say, producing the finances and the building up the society, and they are building up the nation. So we are forgetting that we are not wanting to invest in something which is absolutely critical for nation building, but we are investing in certain things which have got the direct financial benefit. And this is such a big, and useful investment. If you invest in the human resource, if you invest in the human health, it is going to improve everything. If a person is well, he can work, say, 8 hours or 10 hours. If the person is not well, he may not be able to work at all, or he may be working to half the capacity or 1/3 of the capacity. So it is very important that we invest in the health infrastructure.
Let me also talk a little more about ground reality. If the patients attack the doctors, which has unfortunately been happening, doctors, nurses go on strike. I understand the anger. Maybe enough security, certainly enough security not provided to them. They are working in such difficult circumstances, doing their best, yet getting assaulted. That is certainly a shame. But as a doctor, I'm sure you feel the conundrum. How can a doctor go on a strike? That is a question which laymen ask.
So that's a very pertinent question. So I'm going to only answer it in a very simple way. This vicious cycle has to be broken. This cannot be dealt with on an emotional level. It has to be dealt on a scientific level, on a pragmatic level. And I would only end up stating only one sentence. We need to put our medical systems in place. Health, whether we like it or not, cannot be 100% business. It is a fundamental human right. But unfortunately, it's so expensive nowadays that we have to compromise it and we have to make it at least part business. But now in India, we have existence of extremes of health setups. On one side, we have this corporate setups, which are set up by purely market forces. On the other side, we have institutions like AIMS, which can only take care of a fraction of the health costs. We need to create a national health system. The military is national, so they provide security for the whole country. Similarly, we need to have a national health system which could be a public-private partnership, which is part of a larger system which takes care of health of the entire nation. And this is, I think, the need of the hour. So if the systems are in place, the violence automatically will go down because the communications become better, the infrastructure becomes better, things come into place. I think this is the only way. Otherwise, we can go on debating about it for hours and hours, and we may not be able to find a solution.
What's the way out? Yes, we've discussed enough suggestions, but many times when we see resident doctors, go on the strike, when we see, even 4 others on strike, again and again, I remember these television interviews, of the protesters which come, protesting doctors, protesting other medical staff, which, comes on air. They say, give us more security. But having marshals, having security guards, having police in hospitals, one, it cannot happen long term. And two, is that a very short-sighted approach to a problem, which requires a much larger, solution? What would you say about that, sir?
I think creating an army inside the hospital for the security of patients may not be a long-term play. Why not we have an environment which is more cordial and have a good relationship between the patient and doctors? I think everybody needs to believe us that a doctor becomes an hard education after 15 years of education. He is there in the hospital to help the patient. That is his inner conscious, and most of us are for the patients. And finally, but the point here is, it's not that we are the God. We are not God. We are the human beings. That needs to be understood. We try our level best to save each and every patient. Our intention is to save each and every patient, and we have empathy. So this message should be very clear that it's not like a machine, that machine goes haywire, we can put it again and bring into the system back. It's a human being. On the other hand, I will also say that the responsibility lies on all of us, doctors as well as the layman. When they come, they should be like, why a patient is coming to a hospital with a road traffic accident without helmet? Why can't we wear a helmet and be safe? We have to provide those preventive measures. We're talking of healthcare services. Professor Chandra and Professor Verma mentioned that this has to be there. But why that healthcare service is required? Why can't we as a layman put our efforts for the preventive strategies? We have a seat belt. We have the helmet wearing, we have the safe driving rules, we have the diving and swimming pool rules across. Why can't we follow them? Why there is a situation happens that a patient has a road traffic accident, patient is a victim of drowning and comes to the hospital late? This is one. Second thing is, we need to understand and need to have a good cordial relationship. It's not a business. It's just it's a good profession wherein everybody wants to contribute to the healthcare of everybody. So we need to understand, we cannot demand everything from each other. We have to understand the limitations of each other, and let's have a cordial relationship environment. I think on this Independence Day, I can say, let's be independent of those grudges and violence. That is, let's everybody support each other. I would be very happy if a patient is brought to a hospital by a layman with a wound being closed by him, and he supports, doctor, can I help you for this patient till you? Or at least he can say that, okay.
Well, absolutely. Then you have the Good Samaritan bill for the same, but how many people are aware of it, and how many people would actually do what you are suggesting? A noble deed, a deed which wouldn't even get them in trouble. But again, it's really the misgivings of the mind, and there are many I know personally also who think that they would get in trouble if they do take a road accident victim. Okay, Dr. Verma, over to you. A very quick suggestion as we end this Independence Day. How do we achieve freedom from violence against doctors? I know you said investing in primary healthcare, but what can we do immediately, sir?
I think there are 3 important points that I want to re-emphasize. One is that increasing the health expenditure, which is very important for building the health infrastructure. The second is, say, meeting the expectation, the demand and supply, and which is both ways. And the third is that we have to have a holistic change in the society's attitude also. It's not always that it is one-sided, it is both-sided. They need to understand, they need to also feel that, yes, all expectations cannot be met. Medical science is not a perfect science. The people expect something which can absolutely not possible from the medical science point of view. So absolutely. They need to understand that, yes, there are certain things which can be done and there are certain things which cannot be done. So it's the 3 points which I consider very important is increasing the health infrastructure budget, trying to meet the gap between the expectation, demand, and what we can deliver, and then the overall change in the mindset of the people, the society, they need to understand.
All right. Point taken, sir. Dr. Chandra, last point to you, sir. You said that you need a curriculum for doctors. Would you say a curriculum in ethics for people also?
Yes. So since Professor Verma has mentioned about the patient, I would say that we need to create some kind of I would say, national health system whereby we can have electronic medical records, we can have the SOPs for doctors, we can have a special course on ethics and medical counseling for doctors. And then we could also create a large public awareness for the laypersons on how they can create constructively towards the system. And I think this is the need for the hour. We have to ensure that medicine is not just a business. We have to ensure active public-private partnership, because we know no government can actually.
So weeding out profiteering from medical profession, need of the hour. How practical? I'm not too sure, sir, because I have spent lakhs of rupees to get my relatives to the hospital. Basic healthcare, just not even oxygen, and I know the bill I paid. So good suggestion. Hopefully someday it gets implemented. Dr. Garg, last point to you. You said mindset of the people needs to change. If you could give one-line suggestion, how do we do that?
I think it's all inclusive. We need to create more awareness among the public that they can contribute to the healthcare in their own ways. Let's follow the preventive strategies, whatever we can, have a safe, healthy lifestyle modifications. That is must for them. And also they can contribute by learning basic skills. That will be of huge help to the community, because by the time we'll have health infrastructure at every nook and corner of our country, why can't the countrymen give a few initial first aid and resuscitation in a learned way to these patients so that they are safe when they reach hospital?
Well, absolutely. And those courses are available online for free on YouTube. But again, I don't know how many people even watch it. But anyway, sir, thank you for all your suggestions. Cogent, pertinent suggestions. No cacophony in this debate. We tried, of course, patience, for all the viewers to bring the point of view of the medical community, a very positive, constructing discussion, a very riveting discussion. I wish I could continue this longer. Time constraints bind us as journalists, but we hope really that we've sent a positive message to the society. A very happy Independence Day to all our viewers who are watching this show. Only hope this Independence Day from the medical community. Let's free them of violence. When, of course, we speak of our saviors, let's save our saviors. That's, of course, something, a headline which many newspapers also went with. Let's hope that it actually practically gets implemented. Thank you all for watching.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.